Hello, I am Dr. Sathish, specialist pediatrician working in eye care clinic under Emirates Group of Hospitals in Oasis Center. Today's topic is vitamin D. Vitamins are nutrients that cannot be produced in the body and essential for organ functions. Vitamin A, D, E, K are fat soluble vitamins and others are water soluble. Technically, vitamin D is not a vitamin as it is produced in the body, in the skin by exposure to sun's ultraviolet B radiation of wavelength 290 to 320 nanometer. It is a potent secosteroid produced in our body with multiple functions. Vitamin D is useful in preventing aging, skin conditions like psoriasis, cancer, diabetes, infections, and help in the growth of bones and immunity. The term vitamin D refers to ergocalciferol obtained from plant source and cholecalciferol known as vitamin D3 obtained from animal source and produced in the body during exposure to sunlight. 80% are synthesized and 20% we are getting from sources like cereals, butter, cheese, fish and milk. We get cholecalciferol known as vitamin D3 either from animal source or by synthesis in the skin from 7-dehydrocholesterol due to the exposure of sunlight. This is stored in liver after hydroxylation as 25-hydroxycholecalciferol. Then it is converted to 125 hydroxy vitamin D3 in the kidney. This is the active form. It increases the absorption of calcium in the intestine, increase bone resorption, decrease renal excretion of calcium and phosphorus, and maintains calcium and phosphorus homeostasis in the body. The ultraviolet B radiation from sun are strong during April to October here. The best time for sun exposure is between 10 am to 3 pm for 10 to 15 minutes daily or 20 to 30 minutes 3 times in a week. Exposure of arms, legs, hands or face are enough for getting vitamin D. The dark skin use of sunscreen, time of the day and season, and the age of person influence vitamin D production. Vitamin deficiency is a common problem here. Vitamin D status is usually measured by the 25-hydroxy vitamin D level in the blood. Normal range is 30 to 100 nanogram per ml. Below 30 is insufficiency and below 20 is deficiency. Deficiency results in rickets in children and symptomatic osteomalacia in adults. Ricket is due to failure of mineralization of growing bone and cartilage. Children present with poor growth, motor delay, increased susceptibility to infections, delayed tooth eruption and dental caries sometimes with bone pain and irritability. Their frontal did not close in time, frontal bossing, chest deformity like rachitic rosary, widening of wrist and ankle can be seen. When they start walking, bowing of legs appears. X-ray will show cupping, splaying, fraying, and deformities like bowing and osteopenia. In adults, as the bone growth is completed, ricket manifests as bone and muscle pain and weakness due to osteomalacia. The cause of vitamin D deficiency is decreased dietary intake. Some conditions causing malabsorption like celiac disease, cystic fibrosis, inflammatory bowel disease, gut resection surgeries, and liver and kidney diseases. Some medications like anti-epileptic, antiretrovirals, glucocorticoid, and ketoconazole also produce vitamin D deficiency. But the main cause of deficiency is poor exposure to sunlight. Most of the people here stay indoor and go out in the morning or evening and use sunscreens. So it is always better to take vitamin D supplements. Breast milk usually contain 15 to 40 international unit vitamin D per liter. So in exclusively breastfed babies, it is advised to give 400 international units of vitamin D daily till 1 year of age. At risk groups like premature babies, dark-skinned children, vegetarians, those with malabsorption, those on medications need more dose, around 600 to 1000 units per day. It is better to do screening blood test for those who are at risk periodically every 3 to 6 months. If the level is between 20 to 30, give 1000 international units per day for 6 to 8 weeks. If the level is between 12 to 20, give 2000 international units per day for 6 to 8 weeks. If the level is below 12 and child is asymptomatic, you can give 4000 units per day for 6 to 8 weeks. When the level is below 12 and child is symptomatic, you should give 30,000 to 50,000 international units weekly for 6 to 8 weeks and do the follow-up. Always give calcium 30 to 70 milligram per kg in divided doses along with vitamin D to avoid hungry bone syndrome. Continue breastfeeding, educate about diet and sun exposure. Continue maintenance dose after treatment. Vitamin D is going to be a magic remedy for many ailments. So if you suspect vitamin D deficiency, always do a blood test, and if insufficient, take supplements as needed to prevent many illness like cancer in the future. Thank you very much.